80% of adults have herpes.
Congenital syphilis in babies. What, the gays are giving it to pregnant women? No, we're gay.
Right. So you're like the popular kid if you do.
Hi, Alex. Thank you so much for coming back on the show. This is his second time on, and if you didn't catch our first podcast, Alex is a third-year med student in Detroit. He was living and dating in Chicago, and today he's here to tell us all about STIs. So, Alex, tell us a little bit about STIs in the world of COVID.
So from what I've heard, because I actually just did my OB-GYN rotation, I volunteered a lot at, an STI clinic in Detroit. I've also worked at Howard Brown in Chicago, did some volunteering there. Done like a lot of like booth work at like a lot of like, events, trying to do the whole handout condom thing, try to people on STIs. But something I actually heard recently from a couple patients is that they were afraid to go to the doctor to get their normal routine STI testing in fears of contracting COVID from going to the doctor, because, people go to the doctor when they're sick. So, COVID's a thing right now, and why would you want to go put yourself at risk where someone with COVID has been recently?
Right. And you mentioned it was a normal routine. So how often is a normal routine STI check? Like, when would you recommend that someone go in if they're sexually active?
So, it's probably not really realistic to say this, but, whenever you have a new partner is when, a medical professional would kind of recommend it. But we know that that's not always the case. So, if you're sexually active with multiple partners, I'd say, every 3 months is like one of the recommendations that I've seen. Definitely for HIV testing. But the other thing is, like, some STIs take a little while to show up, right? So there's that incubation period where you have to wait. It's, again, STI dependent. Certain STIs we don't really have good testing for. There's a lot of false negatives. Just the list goes on and on.
I think about getting an STI check is the same as self-care. So whenever you're going to do your regular self-care routine, whatever that is for you, if it's like a fun day out or massage or whatever, a self-care is also regular STI checks, right? This is something that can completely really hurt us. So just making it even a part of your regular routine, if you're out there dating and being sexually active with different partners, even if you still are using protection, going and getting those. So what STI are you seeing on the rise right now?
So first off, I love your attitude on like how you said self-check. However, it's kind of invasive. You're getting swabs down your throat, up your urethra, and pretty much any and every orifice that you've had some sort of penetration, right? And it's kind of uncomfortable. And then the other thing is you have to also tell this doctor who, doctors are people too. We have judgments. And as much as we try not to, there's some that will let them show. And, I think that really deters people. But what I think is important is for people to remember that, you can be judged by whoever for whatever, for your skin color, for your gender. And you know what? There's always going to be someone to look down on you. But realistically, this is about you and you being healthy, because there are so many horrible consequences of STIs. For example, like PID, which is pelvic inflammatory disease, can really make it so you're infertile. So if you ever wanted to have a kid with a future partner, you're not going to be able to. And these are horrible consequences. And some of these STIs are asymptomatic. So what you were saying with routine care, extremely important. Just get it done, please. like doctors would rather have you come in if you think there's a problem than feel that judgment. At least the vast majority that I've worked with, I've seen zero judgments. And I understand that perceived judgments are still a thing though.
Yeah, and I think there can be these judgments when we go to different places, whether you're going to your primary care doctor, maybe that you don't know very well, or even a clinic. I know, like the University of Miami, they really promote this. So they make it very easy for you, very easy to get an appointment. I don't even think you had to pay for it, but you kind of go in and the culture was very easy. There were many chairs lined up, so you didn't have to feel like you were the only person that ever did this. And I even see on 95, which is a really major highway here in Miami, and
Mhm.
giant signs about, get your STI check. And they look really cool and inviting. So I think it can be like the culture in what city you're in as well.
Right. No, exactly. But you asked previously, what STIs am I seeing on the rise? So before we talked about like LGBT issues, so I'd say like LGBT and like HPV is a big one. So I don't know, something like 90% of people by the time they're 40 are exposed to HPV.
Right.
I mean, luckily, your body clears, like 90% of people, their body clears the infection spontaneously within 2 years. However, it progresses to cervical cancer, progresses to all of these things. And I'd say LGBT medicine is a little bit behind because I've only found like 3 or 4 places in the Midwest that do anal pap smears, even though anal HPV or anal cancers are really on the rise in gay men. And they're not being treated. And what I think other people need to also recognize is you can have anal HPV without ever having insertive anal sex. So even heterosexual men can get it. And then the other thing it can cause is throat cancer. So, I mean, if you're offered that vaccine, I don't see a reason to not get it.
Okay. And is an anal pap something that you would have to request separately? Like if, women, we have to go in for our routine pap smear, but you know what? I've never had a doctor offer me an anal pap smear.
So, they're only really offered to really high risk groups. So, even if you go on Planned Parenthood's websites, I know Colorado and Arizona, because I did some research into this. And Colorado and Arizona were both like recommending the same guidelines that females have. So like every 3 years getting an anal pap if you're like a sexually active male with multiple partners, not using protection. Yet none of the Planned Parenthood clinics offer anal paps.
Uh,
Um, and yes, it's definitely something you have to ask for. It's not something that anyone's going to give you. I don't know of any primary care physicians in Chicago or Detroit that offer it. I know Howard Brown offers it, but they really only recommend it to HIV positive males. Yeah, it's like, and like I said, it's just because the guidelines are so far behind. But there was a research study that was published in the early 2010s that showed that it was cost effective, just like female paps, yet they're still not being offered.
and I think the awareness isn't even out there, really.
Yeah, I mean, I was kind of shocked. And, this is my 3rd year of medical school that I'm really just finding out about this.
Right, right. I think it's like one, even getting this awareness out there. And then, as a patient, we have to be our best advocate. So even not expecting our doctor to be the one to take the best care of us, but us being aware and having to ask them. I
Right.
wanted to ask you about like STIs in the GLBT community
Mhm.
and the culture. Here in Miami, I think being in a big city, it's something like STIs are something that we talk about a little bit more. Like I'm saying, we see it on billboards, and I know my friends and I like talking about just kind of getting these routine STIs. But tell me about like STIs in the GLBT community.
Um, so from what I've seen, it's as I mentioned before, like in the previous podcast, there's like some people in the LGBT community that really value monogamy, and others that really value being open, exploring their desires sexually. And there was one study that I was looking at that was saying only about the major rise in STIs in the gay community since the release of PrEP, which is the pre-exposure prophylaxis for HIV. So like Descovy and Truvada, those 2 drugs. There was a major rise in STIs about by 30-ish%. And ironically, this giant increase was only seen in about 28% of the community. So this 28% of the community was accounting for this large rise in STIs and not necessarily representative of the community as a whole. Um, but going off of that, just rise in STIs with PrEP. But there's also been a rise in almost every STI across the board across the world too. Britain is like, because I was like reading the British studies because they're kind of interesting.
They are.
Um,
Yeah.
so I was like, but in the States, it's like we had, a 413% rise in syphilis in the last in the last decade or so. And this was since 2008, but in 2000, they were thinking syphilis was going to be eradicated in a couple of years. So um, it's really interesting. And they were pointing fingers that, the 2008 recession is kind of to blame for this, solely because with budget cuts with the recession, they kind of cut a lot of state health funding because they're like, oh, STDs are falling. We don't really need, this isn't that big of an issue. We don't need to be advertising and giving everyone all these tests. And then lo and behold, we're having this major surge of pretty much every STI. And then to double up with that, now we're developing STIs with antibiotic resistance.
Right, which is very, very scary. So, are you seeing condoms, dental dams, things like that, all protective measures being more common in today's world?
I am seeing them in certain people and not others. And some people really advocate against them. Some people are like, oh, I'm on PrEP. I don't really need to worry about this. Some people come in and they literally already know that 80% of people already have herpes of some sort, but only 20% of the people who have it actually show symptoms. So they're just like, kind of assuming, oh, I'm already have it. What's the matter? Like, I don't really need to use protection, or I'm going to be the recipient, the bottom or the recipient of in the sexual relationship. So like, there's really not that much risk. Or, they're like, there's no symptoms, so I don't need to worry about it. There's so many different excuses I've seen people give me. And what's so interesting is like a lot of these people are really well educated. And it's just like, well, if you're so well educated and 50% of people have STIs show no symptoms, right? About half. Depends on the STI. Like, for example, 43% is like with gonorrhea. Like, I'm just spout off facts, but I don't think they're not that useful.
I
But like, we'll just say
really
half.
you're also just really highlighting how prevalent they are, because I think they're not talked about. I mean, I think what I see in my practice the most is herpes. That's what I'm seeing a lot of people call in with and come to me about, the emotional component that comes with it. But I think the statistics kind of tell us it's out there, and that we do need to use protection, and that's another form of self-care.
Oh yeah. And what's so interesting is different STIs affect different socioeconomic like classes differently. It's really interesting, just based on how these interact. But what you were saying with herpes, I'm sure any of these viral STIs have a really traumatic emotional component. And, even if you were to get it from a single partner that you only met for one night, and then that toll that it takes on you, because now it's kind of the onus is on you to tell all of your future partners about this, and feeling that rejection of when someone isn't interested in you solely because of an STI that you really had no real control over, because sometimes protection doesn't even prevent them.
Right. It doesn't always protect them, and especially when we're using like household products. I hear a lot of like using saran wrap as a dental dam, and I'm always saying, well, HIV can come through that.
Yeah.
So even having that feeling of rejection is interesting, because a lot of people are actually struggling with some STI,
Yeah.
and yeah. So I wonder, working in an STI clinic, how do you direct people to tell their partners? Is this something that's kind of routine after they've been diagnosed?
So when it comes to the patients, if they ask, I kind of will talk to them about this, but it's really hard to, really get into the nitty gritty and give them details and like, talk about treatment plans right after you just gave them a lifelong diagnosis, right? Now, when you're talking about like a chlamydia or gonorrhea, where it's, just a quick poke and one pill, and then you're good in 5 days, great. But with the like long term, it's like you kind of need follow up and to really talk to them about it, make sure that they're doing okay. With like my friends who have been confident enough to disclose a diagnosis of herpes or HPV with me, I, I think it's really important to acknowledge to them just how important it is that they were willing to tell you and not to like place any judgment and say like, I'm so glad that you were able to talk to me about this. And I know this is something that must be really difficult for you. And I think, giving them support should be number one rather than, coaching them on what to do next. Because they must feel like, I'm sure they feel so alone during these times. And that's the last thing you want for one of your friends is to feel alone.
We kind of
So
ostracize ourselves too. We put a lot of judgment and criticism on ourselves. We really blame ourselves. There's a lot of internal side of having an STI. I mean, I think a lot of people come to me when they have it and they're feeling okay now. I'm having really difficult dating, or I'm not trying to date because I don't want that response from my partner once I tell them that I have this STI. And I think the challenge also comes to is when do I tell them? And sometimes, we become sexual before we have told them, and sometimes not even telling the partner.
yeah, I mean, I would always advocate for honesty being the best policy,
Of
and
course.
being upfront with your partner because think of the part on the partner's end. If really things do get serious with them and you really do start to have a lot of feelings for them rather than just like a quick hookup, and that's why you weren't going to tell them, and you're like, oh, I'm taking val checks, I'm not virally shedding, the likelihood of them getting it, I'm using protection, there's like the chance of them getting this STI is almost null and void. However, when you finally do tell them, you're kind of like, it's almost like you're giving them the feeling that you betrayed them, right? You betrayed their confidence and their trust. And I think, that's why I'd say honesty is probably the best policy. And, if they really truly love you as a person and like respect you, you know, it shouldn't be that big of an issue nowadays, with all the research and the medication and like the really limited chance of spreading this issue. Even for HPV, things that like don't have treatments yet, they're actually working on a vaccine that will actually not only prevent the spread and you getting HPV, but also treat latent and pre-existing infections.
I love that you just highlight, just because you have this STI doesn't mean you can't be sexually active and that you can't be in this relationship. Sometimes it can be a really strength building and like
Yeah.
bonding building by sharing this with them, right? Anytime we share about who we are, or like any challenge that we're working through or have overcome, that can be a really bonding experience, and it doesn't have to stop any sexual experience, right? There are so many different ways to protect yourself. And if you're out there and you do have an STI, look into some of the protective measures, whether it's the dental dam, condoms. We have a lot of different ways to protect ourselves so that you can still have a really pleasurable and enjoyable sex life.
Yeah, I think you should. I don't think it should really stop you, especially with how prevalent these are. I know I mentioned HPV being super prevalent, and like so is herpes. It's like, most people don't even get herpes like from sexual contact. The vast majority of herpes are from like, kissing grandma or sharing a Pepsi with your friend. It's like the vast majority of these are spread orally. Just so
Right.
the fact that people like shun other people for it is ridiculous, because it's like, if I was to serologically test the entire United States, I'm sure 80 to 90% of us would come up positive.
Right. You're right. It's so right. It's so easy to pass through, and that we should never put these judgments on somebody if they do tell us, and like really
Yeah.
trying to open our mind to it.
Yeah.
I love all your stats and like everything that you said about any STIs. Is there anything you want to tell our listeners of how they can protect themselves, or any advice of just what is really prevalent nowadays?
Like you mentioned, health is like the onus is kind of on the patient, right? Because as a medical or to be doctor, I can't go around and be like, did you get your SDG check on the street? Like, I can't go around and ask all these people, like, did you get tested? Did you get tested? It's like, no, you need to come to me. I can't go around and, ask 300 million people in the US if they're getting tested or not. So the onus is kind of like on the person to go to the doctor and be honest, like, hey, like I had anal intercourse as well, even as a female. Like a female should still say, hey, I had anal intercourse. So like I need to also be swabbed in the anal canal because it can be harbored there. And, STIs being harbored in your throat, that's actually really common because a lot of those won't be treated by the normal injection, like quick injection and the pill, so you kind of need to also be honest and say like, yeah, I've been having unprotected oral sex as well, so you need to have your throat swabbed because we could treat you for a gonorrhea infection, and here you are with the same partner, and now you just reinfected your partner because you gave them oral sex.
So true. So what are some of the legit websites people can go to and learn about STIs, symptoms, like, if they think that they're experiencing one? Like, what's a legit website?
I mean, I would definitely just immediately trust the CDC. I know with COVID and stuff, though, a lot of people are like always questioning that. But when it comes to the STIs, they're really up to date. They're really constantly working on limiting these things. You can also go to your state's health website, especially because they do anonymous free testing for STIs, where you're literally just assigned a number and you create a login based on the number they give you. It's free, it's quick, it's easy, no one knows your name. As you were saying, there's 1,000,000 seats in a line, so it's like you feel like, hundreds of people have sat here before me, nothing's new.
Exactly. Thank you so much for all of your information, and can't wait to have you on next.
Thank you so much, I really appreciate it.
Thanks. Hey everyone, welcome back to Melinda's Mailbag. Today is all about STIs, and I'm so excited to hear what questions my listeners had this week. So Shawnee Mick, my sidekick, start us off with the first question.
I actually have a question of my own. So is STI different than STD?
So STD is sexually transmitted disease. And I feel like that word disease can be like life-ending, very dooming, has like this negative connotation. And an STI or an ST, it doesn't have to have this negative vibe.
Okay.
So STI is a sexually transmitted infection. And I think that's more fitting. So I'm really happy we are changing the name of it and calling it STIs now, because a lot of them are these infections and can be treated.
Good to know. I have genital herpes. I'm nervous to date. I'm afraid people are going to break up with me once they hear I have herpes. When is the best time to tell somebody I have genital herpes? I can imagine anybody with an STI has this question, whether, be something other than herpes.
Right, and I want to point out, I think, too, because this is a question I get a lot in session, and so many people have an STI at some point in their life. And I think it's something that we really should talk about, because it's something that many of us live with, especially herpes. A lot of people have herpes around their lips. Some people have genital herpes. Like, they are different strains, right? But it is a very common infection that many people live with. So I'm so happy, listener, that you sent this question in. So when is an appropriate time to tell somebody, right? How do we know? Well, first off, you must tell your partner before you are sexually active, because then that allows for the two of you or whoever to be protective. So if you are having a breakout, using the protective measures, or if you're not, or you're feeling that it's coming, if your body's been under stress, oftentimes you'll get that breakout. So using the protective gear, which would be a condom, a dental dam, to protect yourself and your partner. But also, this can be a very vulnerable and bonding moment between you and that person you would like to share this with, right? What do I always say? We open up our vulnerability doors, and that is a great way for us to strengthen that relationship.
I know a lot of people would be nervous to bring this up, but the fact is, the number of adults with these infections is pretty high.
It is. It's much more common than we would think.
So I'd imagine this is a common concern with, anybody that's got an infection. Do you know the number of adults that, have some type of herpes or something that would be considered a STI?
I'm glad you asked because it is an astonishingly high number. So according to the National Institutes of Health, because I do follow these stats, and according to them, 80% of adults have oral herpes and 90% have been exposed. So you're talking an immense amount of people, the majority.
That's like almost everybody.
Almost.
So you're most likely going to get a me too. So question number 2 is, I've been having unprotected sex, but I have no symptoms. Am I in the clear?
No, you are not. Because so many symptoms do not show up for months after. And you may not have any symptoms but be living with an infection. So if you did have unprotected sex, go out and get tested because you may not have any of these symptoms for months and the condition may actually be worsening internally.
And the earlier you learn that you have, something in your body, the better you can protect yourself.
Right, and any other partners you have in that time. All right, Sean, third question.
All right. I get cold sores. Can I pass these on to others if I give somebody oral?
Yes, you can. So if you have a cold sore on your lip, you can pass it on to somebody if you give them oral. So we have to be really, really careful. And even if you're not blistering, you can still pass this on. So if you are having a breakout, go out to your doctor and get the medications because it can also be very painful. So go out and get the medication. But in the meantime, give oral only with protection. So if you're using a condom or a dental dam.
There's always a possibility of them transmitting it if there isn't proper protection used.
No, if you're not having a breakout at all, you're okay. But if you are having a breakout, even if you're not having the blisters, you can still spread it.
Gotcha. So for somebody that's not familiar, what would be a symptom?
So what are some of the warning signs, right? When we're going to start shedding the virus, the person will start to have a tingling sensation around their lips or it will be itchy. This is your first warning sign to go to the doctor and get the medication immediately.
So this medication, does it prevent the transmission or does it kind of lessen the symptoms? What's this medication doing?
So the medication is not going to protect you, right? The medication is only going to help hopefully fight that virus. But no, you still have to use protection. That's a really good point, Chuck.
Gotcha. And kind of following up with what you mentioned earlier, it's a lot of times these are stress-induced.
Yes. So a lot of times we will definitely see a breakout happening when we're under an immense amount of stress from work or school. We will see that. Thank you so much for tuning in to Melinda in Miami. It's been so great hearing from all of you. Thank you for sending in your questions. And remember, the best way to keep yourself safe is to have regular STI testing, barrier methods, and talking to your partner and asking them if they have an STI. Let's start this communication. I can't wait to see you all next week. Stay tuned for another new episode. Go out and have